Thank you for joining the National Center's November webinar, Improving Permanence Through Advancing Adoption Competency. We are very happy you're here with us today to hear from Mary and from Dawn about how the National Center and NTI are working together to advance adoption competency. So I have the easy task of going over just some of our standard housekeeping items before I hand it off. So we are recording today's webinar and it will be emailed out to you all after probably later this week. And if you have any questions, please place them in the Q&A box. It helps us to kind of keep the questions distinguished from the hopefully rich discussion that's happening in the chat box. And we'll have some time at the end to go through any questions, but if we miss any questions, we will make sure to get the answers to you in that same follow-up email. All attendees are muted, so if you do have something to say, please put it in the chat, or you can raise your hand and ask to be unmuted. But please do engage with each other and with us in the chat. It makes us all more enjoyable and more productive, so thank you. All right, I think, Dawn, you're up for the agenda.
Well, good afternoon or good morning, everyone, depending on where you are. It's great to be here. I'm Dawn Wilson. I'm the director of our Training Institute at the Center for Adoption Support and Education. I'm also project director for our NTI training, which you're going to learn a little bit more about. And before we get started, I'm going to go ahead and let Mary introduce herself as well.
Thanks, Dawn. Good afternoon or good morning or good evening, wherever you are. My name is Mary Wachanski, and I'm the director of the National Center for Adoption Support, Adoption Competent Mental Health Services. Sorry, we have a lot of acronyms here. Glad to have everyone here today to learn about our efforts to advance adoption competency throughout the nation. So we will be sharing with you some information and hopefully have an engaging conversation.
Great, thanks, Mary. To just get us started, we're going to just briefly go over the agenda for today. We're going to talk about the objectives of today's webinar. We're going to get an overview of the National Center that Mary directs and the work that they're doing in states, tribes, and territories. We're going to have a breakout session, one breakout for folks who are child welfare professionals or in child welfare world, and then a breakout for mental health, where we're going to do a deeper dive just into the NTI curriculum and what it looks like. And then we're going to come back. We'll have some opportunity for questions and answers, some action steps and resources to share, and then a brief survey at the end. We certainly would appreciate your feedback to help us with our future webinars. So next slide. So a little bit about what we hope to accomplish today, our objectives. We want to learn how the National Center is advancing the adoption competency work within states, tribes, and territories through their cross-system steering teams. We want to understand adoption competency and its application to the permanency workforce. We want to identify your role in increasing access to adoption competent mental health services, so whatever role you have and where you sit, and then learn about the NTI curriculum and how it applies to your work, and then information about how to enroll in NTI. So again, thank you for joining us for this 1-hour webinar. Next slide. So I'm going to kick us off a little bit about our lead organization. So Mary and I, and Aaron too, and Sam as well, all work for the Center for Adoption Support and Education. CASE's mission is to improve the well-being and permanence of children and their families by providing adoption competent mental health services, advancing learning to build a responsive national network of professionals, and transforming policy and practice through research and advocacy. CASE was established in 1998. We're a private nonprofit. We're based in the Maryland, DC, Northern Virginia area, where we started out providing mental health services to foster adoptive and kinship families. And from there really grew to become a national leader in the mental health service delivery to this population, as well as a national leader in developing and providing trainings to support this population. So both for families, but also for professionals through our workforce initiatives. And one of those, of course, is our NTI training, which we'll be talking more about. Okay, next slide. So, as I mentioned, you know, Case is a leader in what we consider adoption competence and enhancing and advancing adoption competence across the country. And when we talk about adoption competence, we're talking about more than just serving adoptive families. Excuse me. And when we talk about adoption competence, we're talking about a broader community, the foster, adoptive, and kinship community. And what they have in common is that we're talking about children, youth, and families who've experienced disruption in their primary caregiving relationship. So children who are no longer with their birth families, for instance, who are now living with other families. And what adoption competence is about creating a network of professionals who understand the needs of this population, the unique and nuanced needs. So adoption competence is not a model or intervention. It is not a single practice. It is a comprehensive set of knowledge, values, and skill competencies that professionals, both child welfare and mental health, really need to have to do effective work with this population. When we talk about adoption competence, the skills and the competencies we're talking about are very attachment focused. One of the things that we really think is incredibly important is understanding that healing occurs in the context of a family. And so we want to support families to be successful and stable. And that's the attachment focused piece. Of course, it's trauma informed because we're talking often about children who've had compromised beginnings and early adverse experiences. And we want to make sure that we help folks understand what that means and the impact that has on brain development and body and behavior. We're addressing the core issues that crop up for this population. That includes things like loss and grief, rejection, guilt, shame, things that we really want to help support children, youth, and families to address so that they can, you know, have the best opportunity to do the healing that needs to happen for them to be, you know, to have the well-being and for families to be stable and permanent. And then the other piece of this is really focusing on therapeutic parenting. We want to help parents to develop the skills that they need to reframe behaviors based on a deep understanding of their child's experiences, right? So we talked a little bit about understanding the impact of trauma on brain development, body, and behavior. And it's also understanding that if we don't understand the need that behavior is representing, then we can't really address what's going on. So the behavior you might be seeing is a symptom of an underlying need, and we want to help professionals and family members and parents to understand what that underlying need is. So adoption competency really encompasses a very deep and broad understanding of how we do all of those things and support foster, adoptive, and kinship families to be as successful, as stable as possible. Okay, next slide. So we've been doing this work, as we said, for a number of years now, more than 25 years. And we are helping to develop the continuum of adoption competency from foundational level all the way through advanced. And this gives you sort of an understanding of the roadmap, the different ways that we can support enhancing adoption competency through the work that we do at CASE. And you'll see the first one is the National Center on Adoption Competent Mental Health Services, so the national center that Mary runs. And the focus of that national center is really about doing systems level work. It's about impacting the system's ability to support children, youth, and families through their technical assistance. And you'll learn more about the specific details, knowledge, information, education, and of course, webinars like this. If you move sort of through the road, the first sort of foundational level is our NTI training. And when I say foundational, what I'm really talking about is that NTI provides what we consider to be the core foundation of understanding the needs of this population. So it is sort of the beginning journey of developing and enhancing their adoption competence. And we're going to learn more about that. Following the roadway, we have our training for adoption competency. That is one of our signature programs. That is a training for postmaster's level licensed clinicians. And so we consider that sort of more intermediate, moving to advanced in terms of really doing a deeper dive clinically into understanding the needs of this population. And then going around the next curve is our Case Academy, which is our newest offering. And the Case Academy is really designed, we sort of think of it as a demonstration and teaching clinic. It combines training with clinical service delivery. And we can train both interns and early career, mid-career, advanced level practitioners through coursework and also clinical work. So one of the things we're really proud of at CASE is that we have been sort of the national leader in building this roadmap and providing adoption competent services and education and training. Next slide. All right, I'm going to turn it over to Mary to talk a little bit about the work they're doing in the National Center to advance this work.
Okay, thanks, Dawn. So as Dawn said, this segment of the presentation is really speaking a little bit about the National Center. And this was an initiative that was funded 2 years ago. We are beginning year 3 with the sole purpose of building the capacity of states, tribes, and territories to meet the unique needs of children and their families who've experienced the child welfare system. And so our North Star, we were funded for 5 years and hopefully for longer than that. But our North Star is really to think about that any child who is sitting in any city across the country would be able to avail themselves of mental health services from a trained provider. And that trained provider delivering mental health services would be trained, as Dawn showed you on the roadmap, at a foundational level for NTI, perhaps at an advanced level of TAC, or even further through the academy. And once we build a number of professionals across the nation who have this very specific expertise, then we are also looking at making sure that those families can access services. So when we talk about the National Center, we're talking about developing the workforce, but we're also equally talking about how can we create access to those trained providers so that families can get the services that they need. So that's overall what we hope to accomplish, is that a family one day sitting anywhere in the country will pick up the phone and be able to find a provider who has been trained and can meet their specific needs in this population. Okay, next slide. And so our goal, as I mentioned, we are a 5-year initiative, but really our goal is to build bridges between child serving systems. And our primary systems that we're building bridges with in our collaboration is mental health and child welfare. However, state to state, our collaborations are growing, and for good reason. There are a lot of other systems that are involved in children's lives and are equally invested in ensuring that their well-being is met as best possible. And so we are meeting in the National Center in cross-system collaborations with systems like juvenile justice, like education, like somatic healthcare, and a variety of others, because we believe when we come together as a community of invested systems who really want to strengthen the well-being and permanency of families, we will make better strides. And so that's part of the work of the National Center, again, is to unite all of these child serving systems for a single purpose, and that is to advance the well-being through adoption competent mental health services. And we'll talk a little bit more about that. Next slide. And so when we think about the National Center, I can kind of describe our idea of mobilizing knowledge. That think about ourselves as in the National Center, we have vehicles through which we provide knowledge. One is our universal side of the house, and those are products and services that are available to anyone, any professional, any system. They're free of charge. And those are things like webinars. Those are things like newsletters. Those are things like peer learning experiences. And that can be for a system who is currently engaged in technical assistance, which I'll talk a little bit more about, or not. or they can be concurrent. But we see these types of services, both the knowledge of the universal services along with the technical assistance that's on the ground, as being kind of hand in glove. And together, this constant infusion of knowledge and best practice helps advance the field. And so for 5 to 6 states, tribes, or territories per year, they work with us in consultation and in a change management process to really move forward and advance and enrich adoption competency in their system. And as I mentioned, we do that in 3 distinct areas: by improving the cross-system collaboration, either making them more effective, more efficient, more aligned. We also do that by enhancing the workforce, and that's through professional development. As Dawn talked about, there's specific training courses, which we'll talk about, along with coaching opportunities to help transfer knowledge into practice. And that is our goal, really, to equip the workforce with the skills necessary so that they can be more effective. And last, to make sure that our systems together are looking at accessibility issues. And those are issues, whether that's an affordability issue, geographic accessibility, availability of providers, and a whole host of other factors that actually make access possible. So that's what we're hoping to do in the National Center over these next several years. Next slide. Okay, so this is just a little schematic of what I kind of just talked about, but it makes it pretty simple. And if we start at the far right, all of us and anyone we've ever worked with is really invested in a world where every child connected to adoption, foster, and kinship care thrives. And that means that their well-being, their mental well-being is intact. And we know that mental well-being for children, particularly, is the foundation and trajectory for all other development. So when a child is doing well emotionally, we know that they're more likely to do well educationally, with peers, with stability, with family, and so forth. So at the foundation of development is this emotional well-being, and we really want to capture this as an end state for all of the systems that we're working with. And in order to get there, as I mentioned, it's kind of 2 things that we put together. We build a workforce, we retain a workforce, and we equip a workforce with knowledge, skills, and the ability to change and sustain practice that's going to be effective. So that's our blue on the left circle. And we pair that with accessibility to make sure that that trained workforce can then be accessible to families. So the 2 of those come together to equal our vision. There's a little line at the bottom called cross-system collaboration, because we do believe that through this collaboration with all systems, and we're seeing it state to state that we're working in, there are a lot of gaps which we are hoping to fill. There's redundancies and duplications which we're trying to eliminate. There's innovations that we bring from state to state to help move things more quickly or deeper. So that's, in a nutshell, the work of the National Center. Next slide. Okay, so it looks like we're at a time where we're going to do a breakout. And as I understand it, those of you who had enrolled as child welfare professionals will break out in a group with Dawn, and those who have signed up as a mental health provider or in that field of interest are going to come with me into the breakout. We'll be in a breakout for about 20 minutes to learn a little bit more, and then we'll come back together, as Dawn mentioned, to come together a little bit more to learn some things that are going to be relevant to both groups.
Ooh, that time went fast.
Wow.
Yeah.
I was mid-sentence, so that's okay, but we'll pick up. Yes.
And we will be sure for all of you, we will share the access to enrolling in NTI in the follow-up email as well. I know that part kind of got cut off at the end for some of us.
Yep. And yes, okay.
All right, Mary, do I have this one? I'm sorry. I do. Yeah.
Yeah.
Okay. So how can families access adoption competent providers? So one of the things that we're really excited about is that we have a directory, a national directory available on our website and on the National Center website. It's the same directory that can provide support for you, for professionals, and for family members who are looking for professionals, mental health professionals in particular, who have training in adoption competence. So this will provide you access to professionals across the country who have been trained in either our NTI training or our TAC training. Right now, those are the two trainings that we focus on. It is searchable. So any mental health professional who completes our NTI training has the opportunity to be submitted to our directory. Oh, good, Tanya. I see you want to update your information. Okay, we'll get you information about that. We have a submission form that you can fill out to update that information, because we would love to have it obviously accurate, of course. So we'll send out maybe that link to you, or maybe I'll try to put it in the chat when Mary's talking. How's that? I'll try to do that. So this directory, again, is we try to keep it as up to date as possible, and it is available for you to help find adoption competent clinicians, or clinicians who I would say are doing their best to really enhance their adoption competency. They may be on the journey at many different levels, but it is a great start to find someone in your state who can support the families that you're serving. And our goal, of course, is for every mental health professional who completes NTI would be on this directory. Next slide. Oh, thank you.
Is that the right one, Dawn?
That should be it, yes.
Okay.
And then this is a quote from a parent, and I just think we really cannot emphasize how incredibly important it is for families to have someone who understands the depth of the depth of what they're experiencing, and understands those nuances to really help them get the support they need. So the most positive experience I've had with a mental health professional was defined by deep empathy, adoption-informed knowledge, intergenerational insight, and empowerment. They met me where I was, embraced the complexity of my story, and helped me pass on a more honest, emotionally intelligent legacy to the next generation. These qualities are not just helpful, they are essential. Next slide. All right. And I mentioned to my group that we have some wonderful tools in this curriculum. One of them is actually this handout, which is Finding the Right Mental Health Therapist. It's also a tool you can find on the National Center website. And it really does help folks think about the questions they need to ask a therapist to make sure they're getting the kind of therapist that they need. So it lists questions you can ask. You can give this handout to families. You can certainly talk with families about the questions they might want to think about asking as they're trying to find the right therapist that can meet their needs. Anything else about that, Mary?
No, I think that's it.
Okay.
Yeah, and so thanks, Dawn. And as Dawn was saying, part of the work of the National Center is really focusing on access. And one way we can do that is by trained professionals being listed in the directory, because at the end of the day, we want families to be able to find providers. And we also want other clinicians to be able to refer to specialty clinicians if they need or want to. So, what you can do to support the work and the commitment to moving adoption competency forward is to build your system's capacity to sustain the development of adoption competent workforce. And we know that all systems are starting at different places, and for the National Center, you do not need to go through a specific readiness assessment. You just need to want to know that this is some support that you would like to advance and develop your adoption competency. We can talk about more the work that we do together, which is around building smooth referral processes for families so that it's a process that is easy, that is transparent. Sometimes it's tricky for families, and families get lost in that referral process. You can, right now today, if you saw the directory and this is new to you and you want to refer a family to an adoption competent provider, you can go onto our website, you'll see the directory, and you can find someone in your community, hopefully, that you could refer to. If you're interested in the training, we welcome you to sign up. Again, we showed some enrollment information. It is free. It is available anytime. All you have to do is sign up. And also, as we talked a little bit about the Knowledge Hub and the Universal Technical Assistance, if you're not quite ready to take all the training, but you want to see what this is about, you can poke around in our Knowledge Hub. It'll give you information on best practices in a variety of different content areas, a lot of really critical relevant, credible resources are there, housed in one website to make it easy for you. So please check that out, and then connect with the National Center around ongoing knowledge development opportunities. As we talked a little bit about, we try to make our webinars informative. We try to advance cross collaborative conversations and peer learning. So there's lots of opportunities to learn more, to connect with others, and to commit to this value proposition of helping systems become more adoption competent so they then can serve families and drive better outcomes for children. And Dawn just put the enrollment information in the chat. That only takes a minute to do. So if you would like to do that, we'd love to see you online. And next slide. Okay, so there's some primer if we want to think about some real priority documents that you might want to check out. And again, there was a question around, will this slide deck be shared? And the answer is yes. So you'll have this once again. But these are some pulled out key, kind of in a scaffolding way: brief introduction to adoption competency, an overview for mental health professionals, and so on. A little bit about the TAC curriculum, some efficacy, effectiveness studies, and then looking at the mental health providers achieving the outcomes that matter most to families. There's a unique piece that's on our site that really speaks to what do families care most about. We all as clinicians have our own indicators for outcomes, but families care specifically about specific outcomes. So please check that one out too. Okay. So at least for the National Center, we would love for you to complete a brief webinar survey. I know it's always part of our work as we are federally funded and required to get some feedback so that we can continue to improve. If you would do that, that would be great. Visiting the National Center website for more information. It's a really easy name, bridgesformentalhealth.org. If you have any questions, you can reach out to me or any of our team listed on our website. And you can also sign up for our email simply by using the QR code to connect with us.
And Mary, I put my email also in the chat for anybody
Perfect.
to reach out directly with questions about NTI or implementation support. We'd
Yep.
love to work with you.
Yep. That's great. Yeah, so we hope that, thanks, Erin. I was gonna say, is there one more slide where it's a little bit bigger? Really quick, again, part of our work is always CQI, looking at what we can do better, more effectively. We listen intently to feedback, so please take a moment just to answer the survey. And if there's anything that you would like from us in the open-ended comments, like you'd like us to reach out to you, you're interested in X or Y, please let us know and we will follow up with that. And Erin, I think we answered, there weren't any outstanding questions in the chat, correct? Yeah.
Nope. And I don't see any in the Q&A box either. But if you do, we have a few minutes. So if anyone has questions, please feel free to put them in the chat, and I can monitor. Oh, new nonprofit. Thank you, Maria. I will definitely take a look.
Yeah, Maria was in our group, Integrative Healthcare, and started a new nonprofit as an adult adoptee. Thank you, Maria, we had a lot of different, thanks to all of you who are private providers, who are part of organizations. We had someone from Centene in our group and just a wide variety of professionals. And Diana has a question.
Hi, thanks very much for the information. I'm with the Association for Children's Mental Health in Michigan. And I'm wondering if you affiliate at all with the Adoptive Family Support Network.
I'm sorry, can you say that again, Diana?
It's called the Adoptive Family Support Network. And I'm asking because I also lead our parent advisory committee, and I have a member on that committee that works for the Adoptive Family Support Network. And we were just talking today about the need for more training. We actually had a parent that was dealing with an issue with one of her adopted sons. And so I was just wondering if you do anything with or together with the Adoptive Family Support Network.
First, Diane, I wanted to let you know that we have just kicked off working with Michigan as a state,
Yeah.
which will be great. And they are forming their steering committee now. So I'm not sure the various people who will be a part of that. But as far as the organization, AFSP, Dawn, do you know anything about working with them?
No, I'm not. I don't at this point. We've
Okay.
done some work in Michigan, but most of our work has been with post-adoption providers, so.
Mhm.
Or we've also worked with the NESW in Michigan, but not with that organization specifically.
Mhm.
Okay. All right, just curious, and I'll let her know about you all too.
Great. Real quick, there's a couple questions. Let's see. Is there a list of all the states that NTI is in? So, yes, Jenny, we do have a map that is focused on the child welfare side. We're working on a map on the mental health side. But we could certainly share that map. I don't know, Erin, if it's available currently on the National Center.
I don't think so, but it certainly could be.
Yeah, all right, well, we'll definitely make sure that's available to folks. We are in about, I think it's 32 states now at some level, not across the whole system necessarily. But working with staff at some level in about 32 states. On the child welfare side, mental health side, it's not quite that robust. So we would love to get obviously more involvement on the mental health side. And then somebody asked, I'm getting ready to put in the chat something about NTI versus TAC. Just to clarify, NTI is web-based, and for mental health professionals, it's 27 hours. TAC is a 72-hour instructor-led training, so it takes quite a bit longer to complete it. It's more clinically focused, so a deeper clinical dive, and it is 72 hours for licensed clinicians or clinicians who are moving to licensure. So NTI, we don't require any particular degree, license, certificate, but for TAC, we do. That's the main difference. So, be interested in coming to cases.
And there was one other, Maria was asking if we worked with Arizona. We haven't yet. Mary, have we had conversations?
No, we have not with Arizona yet, but we are open to have conversations with any state. So in one of our National Center videos, we have a little tagline, and it only takes one person to start the conversation. So the inquiry for Arizona, please reach out. We'll be happy to follow up. How can I facilitate? Feel free to reach out to me at any point, Maria. We'd love to talk more.
And somebody did ask, is NTI completion is not required for TAC? No.
And Sandra has her hand raised. You should be able to speak up, Sandra.
Okay, hi. I just have a question regarding in the TAC TAC. The training is 72 hours. However, I would like to know what is the price for that training?
That's a good question, Sandra. So the price really depends on who is offering it in the states that have tax sites. So not every state has a tax site. And when we offer a TAC cohort that isn't funded by some other funding source, so we do have some grants and foundations that will pay for a TAC cohort. The cost could be $1,500 or more, depending on the site. But sometimes TAC is available for free, and it depends. For instance, there are some TAC cohorts that can be offered in TAC sites through the National Center. We work with the Post-Adopt Center that is also working with some states to provide TAC cohorts. So there are opportunities in some states, depending on what the resource is, for TAC cohorts for free or very, very low cost. Thank you, Sandra. And Richard?
Oh, I didn't get you unmuted. Sorry, one sec. I was busy in the chat. Sorry, Richard. One sec. There you go. You should be able to speak.
So, okay, I'm unmuted. But real quick, I took the TAC course. Initially when I was in the inaugural class in Georgia that they offered.
Oh, wow.
They've offered it several times since then, and I believe you can get it here still with no cost. Years later, I took the exam, and I was able to pass the exam with a review. Where does and I want to take the 27 hours. I want to make sure I get the 27 hours in. As far as where does that put me on the path to adoption competence?
Great. Oh, you asked a great question, Richard. And first of all, thank you for your involvement in TAC. It sounds like that was Georgia's been a partner of ours for about 10 years. So
Yeah.
that's great to hear. So obviously, our directory provides lists of people who completed both TAC and NTI. And if you were a graduate of both, then you would also be listed as having had both trainings.
Okay.
And with TAC, you get the digital badge. So when you passed your test, you should have gotten information about that. Did you get that, Richard? Just
I didn't, I was told to watch out, the new badge is coming, but I've watched out and I hadn't arrived yet.
okay. So let me do this. I'll make a note and we'll be sure to reach out, Richard, about that. And that will also give you information about how to submit your information to the directory to make sure it's all up to date.
Okay, fantastic.
I'll go ahead and do that. Thank you.
Okay.
Perfect timing. We're right at 2 o'clock. So thank you everyone for joining us today, and be on the lookout. We will be sending an email later this week with the recording and any follow-up resources.
Oh, fantastic. Okay.
Have a great rest of the day.
Okay. It's okay to leave now. Okay.
Yes, it is.
Okay.
We'll reach out, Richard. Yeah.
Yep.
Okay. Thank
Thanks,
you.
everyone. Mhm.
All right. Bye-bye.